Hey y'all, it's me. It's your girl, the real deal. You already know. Like, share, and subscribe. What's up, real deal? How y'all doing? And we back on day 4. Day 4 is very important to us on Aniya. So let me add day 4 right here. Day 4, they tested a lot of people testifying in behalf little baby oh 1 second, y'all. Anaya. Um what's gonna happen in this segment of the trial at the deputy medical examiner, okay, says that 4-year-old Anaya slowly wiggled away as her organs revolted against her. She was slowly dying, y'all. But we don't want to say that. This diminishing, 4-year-old Anaya died a slow death as her body just slipping away from the mom. And I don't understand how would a mom even watch this. You know what I mean? But it was something going on. So just as a mother, period, what she had, like, she didn't have the kind of stroke. The baby didn't have, she didn't suffer with a stroke like grown people had. But she had suffered a stroke. That's what they said, but not like a grown person stroke. She was dying, y'all. They weren't even feeding the baby. They didn't feed the baby. And so what I'm gonna tell y'all right now, what happened? Anaya little bitty body dropped off at a Jacksonville hospital after suffering a gun. No, I know they ain't talking about the baby. I'm no, 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 no. Take that back, y'all. Take that back. No, 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 no. This ain't got nothing to do with no gunshot. The deputy is gonna get into what happened, y'all. Gonna get into the cause of death, okay? This baby. So let's just listen to this. I don't want to give it away, okay? All right, y'all. But just being a mother, knowing your, oh, I can't do this.
You may be seated. You may call your next witness.
Thank you, Your Honor. The state calls Dr. Joseph Vilo.
Raise your right hand, doctor. You solemnly swear you'll testify to the truth, the whole truth, and nothing but the truth, and this you do, as you shall answer to God, or the pains and penalty of perjury.
I will.
Doctor.
Hello?
You testified before, I assume?
Yes, I have.
You know about the microphone in the chair.
Yes, I do.
I don't have to repeat that. Go ahead.
Thank you, Your Honor. Good afternoon.
People are bailing on California.
This is going to
Half of
be interesting, y'all.
Californians are considered.
It looks scary.
Good afternoon, Dr. Filo.
Hello?
Please state your full name, spelling your last name for the court reporter.
Joseph Andrew E.L.O.
And sir, by whom are you employed?
I am a forensic pathologist and the chief deputy medical examiner for Cuyahoga County Medical Examiner's Office here in Cleveland, Ohio.
And how long have you been employed?
I've been in place, which is 7+ years. Previous to that, we were the coroner's office. So I've been at both the coroner's office and the medical examiner's office for almost 22 years.
And doctor, what kind of training and experience have you obtained in order for you to maintain your position?
Or
I
I
mean,
mean,
on behalf of defendant Dave, can stipulate that Dr. Philo is an expert in forensic pathology and can render an opinion in this case, and he's testified on hundreds of occasions that I'm aware.
I appreciate your stipulation, but I would like the jury to know some of the background between forensic pathology and anatomic pathology.
Judge, could we go so far as to stipulate, we know him very well, he is a brilliant pathologist.
maybe the jury wants to get to know.
Thank you, counsel. Dr. Philo, just briefly, we won't go through everything, just briefly, what kind of background do you have? First of all, are you a licensed medical doctor?
I am a doctor of osteopathy, and I'm licensed by the state of Ohio to practice medicine. And I received my medical degree from the University of Health Sciences in Kansas City, Missouri in 1992. Between 1992 and 1993, I completed an osteopathic internship at Wilson Memorial Hospital in Johnson City, New York. Between 1993 and 1997, I completed an anatomic pathology and clinical pathology residency at the Cleveland Clinic Foundation here in Cleveland, Ohio. And between 1997 and 1998, I completed a forensic pathology fellowship at the Cuyahoga County Coroner's Office, also here in Cleveland, Ohio.
And doctor, are you board certified?
Yes, I am.
Can you explain to the ladies and gentlemen of the jury what it means to be board certified in your particular discipline?
Board certification means that I have learned or went through the basic training and reached the minimal standards of competency in that field. And that includes, I've done the minimum training, and then I've taken examinations in order to pass those board examinations. And I'm board certified in anatomic pathology, clinical pathology, and forensic pathology.
And doctor, and we'll talk about the different pathologies that you're board certified in. Sir, do you also teach?
Yes, I do.
And where do you teach?
I teach at all of the residency training programs here in Cleveland. So that includes Metro Health Medical Center, Case Western Reserves University Hospital, and the Cleveland Clinic Foundation. I also teach at the Podiatry School of Kent State University down in Independence, Ohio. I also am a coordinator for the EMS and first responders. There's an education symposium that I host twice a year at the medical examiner's office. And I teach every day because I am the Forensic Pathology Fellowship Program Director. So it's part of my responsibility to teach doctors who are anatomic pathologists in order to become forensic pathologists.
And Dr. Philo, have you also been responsible for participating in presentations and in authoring articles with in the different areas of forensic pathology and or clinical pathology?
Yes, I have.
And sir,
Sometimes the only thing more difficult than running a business.
approximately how many autopsies have you done? There's States Exhibit 301, 305, 307, 309, 310, 311, 313, 314, 317, 318, 319, 327, 328, 329, 332, 334, 338, and 339. Just take a moment yourself and please keep them pace down.
They know they love to sit down. He did this, the examiner that did the autopsy.
I've done so.
All right, doctor, do those photographs that I have handed you fairly and accurately represent the photographs that you had taken of Aniya Marie Garrett on March 12th, 2018?
Yes, they do.
All right. And doctor, just for purposes of making this record clear, you've indicated that you have testified over 200 times and in, 189,
189, yes. Not quite
189
200.
times. And in those 189 times, you were deemed an expert.
Yes.
At this time, Your Honor, the state would like to present Dr. Filo as a forensic expert in forensic pathology.
I think they've already stipulated into that.
I believe Mr. Shaughnessy and Mr. Marie did, but the other,
He's an expert.
thank you. All right, Dr. Filo, with regards to your examination of Aniya Day, let's start with your report before we get to any of the photographs, sir. And you indicated to, excuse me, strike that. I'd like you to indicate to this jury, when you first come upon a patient, what are the protocols that are followed at the medical examiner's office? How are you dressed? Who's in the room with you? And what do you begin to do from the moment you walk in?
Well, first of all, when the body is received at our office, it's assigned a unique number, and that unique number is assigned just to that person's case work as it progresses through the office. Once the body is received, several photographs are taken to document how we receive the body. So typically the body bag, we unzip the body bag to see what's on the inside and take a photograph of that. And then several other photographs are taken as we remove the body from the body bag. Depending on where the body comes from, they may be clothed, partially clothed, nude, perhaps in a hospital gown. If there's any suspicion for violence, oftentimes their hands and or feet will have paper bags on them to preserve evidence. All of that is documented photographically. When I start up an autopsy, I'm in personal protective wear that includes eyewear, a face mask, plastic gown, as well as latex gloves and foot hair cover. The autopsy is done in a room where we can do 3 autopsies at a time. So it's not just me in the room, but I am only working on 1 autopsy at a time. And I have an autopsy assistant helping me who helps move the body, take off any clothing or any evidence that needs to be taken. And that assistant also cuts on the body to take out the organs. And then I'll examine the organs at a table next to where the deceased is.
Getting an LLC for your business doesn't have to look like this. Just Google LLC Taylor Brands. It's totally easy. You pick a state, you fill out your information.
So a photographer who's taking pictures at my discretion. There's also someone with a trace evidence who's, if there's any evidence on the body or in the body that I need submitted to the laboratories, they're working with me as well.
All right, Dr. Filo. Now, when the body of Aniya Day was transferred to the medical examiner's office, and starting with your report of autopsy, sir, what were your first observations of this child?
Well, the first observation is that she is a Black female who is severely malnourished. We took her length and her weight, and then I did eye color and hair color, and then an external examination looking for any marks on her body, any signs of injuries, any signs of identifying scars or tattoos. She didn't have any tattoos. But that was done with the initial external examination. But certainly she is very, very thin.
And Dr. Filo, so what were your findings with regards to at that point?
She is a 4-year-old girl, and she measured 40 inches in length and weighed 26 pounds. 40 inches for a 4-year-old is meaning she's in the 50th percentile. That means that she's average, that half the children of her age are taller than she is, the other half are shorter than she is. Her weight is 26 pounds. That is less than 3 percentiles. So that means 97% of children that her length, her 40 inches, are heavier than she is. So she's extremely malnourished.
All right. And so, doctor, in going through your report, do you want to go through your anatomic diagnosis first and how you came to your determinations? How would you like to do it? And then we'll talk about the photographs later.
No, that's fine. When I did the external examination, I'm looking for any signs of injuries or illnesses. And certainly the major illness that I see is malnourishment, as I stated those findings there. Her skin is very loose, and that's because she's lost the muscles and fat that make our skin more plump. And I can see her underlying bones. Looking for signs of injuries, she essentially has a very prominent black eye. She's got a bruise around her left eye, and it's a very prominent purple color with a laceration, which is a tear caused by blunt trauma of her left upper eyelid. She also has a bruise on the right side of her forehead.
I mean, how could you look at your child like that? How can any woman just look at their child like that and just let them slowly malnourished just go away? She's just stripping away, y'all. She's
And then she has some scattered abrasions on her left arm and as well as her back. There's also some areas where her skin has sloughed off. They were blisters at one time, and those are lower legs on both the right and left lower legs and her feet. I documented everything externally and then did an internal examination, which means cutting on the organs, cutting on the skin in the front, removing the ribs to look at the organs, and then making a cut from ear to ear across the top of the scalp to pull back the scalp and then cut around the skull to see what's on the inside of the skull. Internally, she has, consistent with a loss of soft tissue. So she doesn't have much fat. Her muscles have somewhat wasted away. I noticed that she has some signs of shock. Shock being she's got hemorrhages of her skin around her right eye. Those are called petechial hemorrhages. It's as the body is slowly dying, which is shock. She gets small hemorrhages. There's also some collapsing of her lungs, meaning she's not taking deep breaths, and so the lungs are collapsing. And she's also developed some pancreatitis, which is inflammation of the pancreas. Because she's not eating as she should be, her pancreas is starting to digest itself because it secretes enzymes, which are chemicals to break down food. She also has developed some ulcers of her stomach, also because of shock for lack of food. Those were all in her torso. I didn't see any signs of infection, any signs of broken bones, any other reason for her malnourishment. But on the inside of her head, she has evidence of previous injury. She's got the bruises I stated on the right side of her forehead. There's no injuries to the underlying skull, but on the surface of her brain, she has what's known as, she's got a healing blood clot. The medical term is a subdural hematoma, which is blood that has collected on the surface of the brain, but below the dura, which is a thin membrane that goes around the entire skull and spinal canal. Because of that hematoma or blood clot, it had pressed on the surface of the brain to cause her left side of her brain to have a stroke. So a stroke is dead brain tissue. And all of that had happened weeks to months prior to her death. There's also some evidence that she had some hemorrhage or some bleeding around her eyeballs. There's also some a little bit of hemorrhage that extended over to her right side of her brain. But most of the injuries are on the left side of her dura, her head, and her brain.
Recordings just got
That
better.
baby supper, y'all.
Hey, it's Dana from
It
StreamYard.
was
I'm
slowly
so excited to
slipping
announce
away.
that local recordings are now available.
Now, Dr. Philo, can we talk about your anatomic diagnosis so we understand the proper terminology? You have one impacts to the head as numeral number 1, correct?
Yes.
All right, and we have contusions of the right forehead. What is a contusion?
Contusion is a bruise, and that is on her right forehead, what I saw on the outside of her body.
All right, and can you determine is it a recent, an acute injury, or is it an injury from a while ago?
It's not a fresh bruise based on the coloring. So it's been present there for probably about a week, plus or minus a couple of days. It didn't happen, like I said, at the time of her ultimate death, but it's been there for about a week.
All right, section B, can you please articulate what the words are?
So I put things in an outline form. So Roman numeral 1 are her head injuries, and I stated that the bruise or the contusion of the right forehead. The next one is a contusion and ecchymosis of the left periorbital and left lateral orbital face. That's doctor word for a black eye. Because there's bruising, that's a contusion from direct trauma, and ecchymosis is bleeding associated with the initial injury. And because of that, there's the next injury, which is subcutaneous, that's below the skin, swelling of left eyelids. Her eyelids were so swollen, it was difficult to actually open them, pry open for me to see the colors of her left eye.
And do we have a timing of that, sir?
That is going to be around 2 days or so prior to her death, the black eye.
So she was alive when she got that?
Yes.
Okay.
The next injury is a laceration, which is a tear of her left upper eyelid. It was relatively small, but on the top of her left eyelid. Those were all the external injuries. The next category is recent hemorrhages within paraocular soft tissues. That means that she had hemorrhage not on the surface of the eyeball, but in the connective tissues around the eyeball. So I'm able to look inside her skull and see that she had hemorrhage in those eyes, around those eyes, a time prior, weeks to months.
I mean, ain't nobody paid that no attention in the family. Cause sister said the baby came around her. Or did the baby come around? The sister also said that Sierra distanced herself away from her. So that's what was going on. She was she didn't want the baby anymore. Should have just gave him to the daddy.
Based on there's no fresh hemorrhage there.
All right. Section F.
Section F is essentially the main reasons why she died, and that's the organized left subdural hematoma. That means a hematoma is a blood clot, and organized means it's been there for a while and the body is trying to cure itself or heal itself by absorbing that blood back into the body. And the body is fascinating in that it can heal itself within reason when given the opportunity. And that shows that because of that hematoma, that blood clot, her body was trying to resorb it back and heal herself. Unfortunately, the damage to the brain is not as able to heal itself with that. because of the nature of that blood clot, it had been present there for weeks to months prior to her death, because of how the tissue is healing off that hematoma or blood clot. As I stated, the blood clot, when it's blood that's in the on top of the brain, and the brain is very snug within the skull. As the blood clot expands, it presses on the brain, and that causes secondary complications, which I list as subacute cerebral infarctions in the distribution of the left anterior and the left posterior cerebral arteries.
What?
That is doctor terminology for a stroke that has happened fairly recently, and it still hasn't gotten down to a complete scar. So there's still that the body is remodeling and trying to wall off how far the stroke is. And the stroke is essentially on the front portion of the left brain and the back portion of the left brain, just on the left-hand side.
Recently,
Jeez.
for no reason at all, I
Baby
asked Mint
suffer,
Mobile's legal
y'all.
team if big wireless companies are allowed to raise.
Nobody do nothing about it.
Recently, what do you mean by that?
At a minimum, this is 2 weeks that the stroke has been there. It could be going on for several weeks, beyond 2, even up to several months.
Okay. Number 2.
There's the next complication of the subdural hematoma is cerebellar Purkinje, Purkinje cell loss. Those are neurons in the back part of the brain that have essentially died off because of the lack of oxygen to the brain, caused by that bleeding that did not allow blood to get into the brain and cause the stroke. The part of the brain that's affected is the part of the brain that's responsible for muscle coordination. So she would be, if she was able to walk, she would be stuporous and clumsy and not coordinated because she's got a stroke in that part of the brain as well. The last complication is remote left optic nerve subdural hemorrhage. That means that there was bleeding that extended from the brain to the left eyeball, and that had happened at or near the same time that the subdural hematoma occurred.
All right, doctor. And then you move on to malnutrition. And what are your findings with regards to malnutrition?
Malnutrition is essentially starvation, and I list all of the supporting features of her malnutrition, including her body length of 40 inches, which I stated was in the 50th percentile for all girls.
Yeah, how in the world could a woman let a man do this to her child? No. How? How could you starve your own child? A baby, 4. Not 18, not 15, not 16, not 13, 4. It don't even take much to feed him. They were so cruel to them. How would they pay for it?
Girls of that age. Her body weight is 26 pounds, which is less than the 3rd percentile. She should be around 36 pounds to be in the 50th percentile for her weight. Her body mass index is calculated to be 11.42. Ideal is between 18 and 25 or so. So she's severely malnourished, way below the 18. I list she's got loose, wrinkled, and redundant skin. She's lost so much of her underlying muscles and fat tissue that her skin looks like an older person, where it's wrinkling and sagging because she's lost the plumpness of the underlying muscles and fat. And I specifically mentioned subcutaneous soft tissue, which is muscle and adipose tissue atrophy that's wasting away, which causes the skin to look loose. Then she developed some organ complications, which include acute pancreatitis. As I stated, she's not eating well, so her pancreas is inflamed because it doesn't have any food to digest, so it starts to digest its own organ. She has acute hemorrhagic gastropathy, and those are the ulcers that are in her stomach because she's forming too much acid as normal digestion, but not any food going in her stomach. So it's starting to erode her internal lining of her stomach. She has pulmonary atelectasis and airspace hemorrhage. These are the lung findings where she's not breathing deep, so her lungs are partially collapsed. That's atelectasis. And then part of the shock is the blood needs to go someplace that's pumping through the lungs, so it's going into the air spaces. So she's got some bleeding on the inside of her lungs. And then finally, she's got cutaneous petechiae of right infraorbital ridge. Those are skin punctate or dot-like hemorrhages on the right lower eyelid, and that's shock because again the body is slowing down and blood kind of goes to path of least resistance, and in this case it was on the right side of her face.
Hi guys, today I'm sharing True Connect,
No,
service. They are on a mission
what
to
y'all
connect
thinking?
the
What y'all
underconnected.
thinking, man? I'm just...
All right, doctor, and then you move on to Roman numeral 3.
The next category are blunt impacts to her trunk, which is the thorax and abdomen and pelvis area, and extremities, which are arms and legs, with abrasions, which are scratches, of the posterior left thorax, that's the left back where the ribs are, also on her left upper arm and her left upper leg. These are minor injuries, but they're on her body, and so I document what they are and where they are.
Roman numeral number 4.
These include the multifocal, meaning that they're in various areas, but clustered areas of skin slippage of undetermined etiology on both lower legs and her right foot. As I described, she's got what appeared to be blisters at one time that had popped. The fluid had come out. And so now I just see them as losses of skin on her lower legs and her right foot. And I'm not sure exactly where they came from. I can't tell scientifically or pathologically what caused those.
Roman numeral 5.
Roman numeral 5 is a superficial cutaneous ulcers of both lower legs. These are the beginnings of bed sores that are forming on her lower legs.
And doctor, before we get to the cause and the manner of death and your other conditions, you then, you've done an external examination, then you go in and you do an internal examination. And what are your findings with regards to, well, first of all, let's start on page 1, your external and internal evidence of recent injury. Can you talk to us about that?
I found that she's got the injuries, and I sort of categorize them where they're located. So she's got 5 injuries on her head. She's got 1 area of injuries on her thorax or her left back. And then she's got 6 injuries scattered on her arms and legs. Beginning with the head, and the numbering and how I identify them, they do not indicate that, because they're on the head, they happened first or long before she died. It's just how I go from head to toe to categorize everything. So on her head, she has 5 areas of injury, and this is where I'm more specific about size and color and shape and where they're located. And I described the first one as a 1.5 by 1.25 inch pink, tan, and gray contusion, which is a bruise, in the medial, which is in the mid portion or the central portion of the right forehead. The next injury is how I describe her black eye of her left eye. The color, the size, it's 3 inches by 1.75 inches. And there's also a 1/2 inch superficial laceration, which is the tear of the left upper eyelid. And then the eyelids are essentially swollen closed, just on the left side.
And doctor, with regards to 1 and 2 there, your findings, the pink tan gray contusion in the medial right forehead, with regards to timing of that, within a week?
Yes.
And with regards to your second, your 3-inch times 1 3/4, mostly purple contusion, the black eye that we talk about, that is less than 2 days.
Yes.
All right, go on to number 3 and 4.
Number 3 is a 1/16 inch by 1/16 inch abrasion on the anterior, which is the front surface of the right earlobe, a very minor scratch on her front of her right earlobe. Number 4 describes the subdural hematoma. And I describe it with colors, how thick it is. The maximal thickness is 0.2 centimeters. That's 2 millimeters. But it certainly was thicker at one time to compress the brain. And there is evidence that it had stained the other side of the dura. So the hematoma is on the left side. That's the blood clot. Some of that blood leaked over to the right side, but most of the injury is on the left side of her brain.
And just for purposes of clarification, doctor, what does the left side of the brain monitor in our body? What is it responsible for?
It's essentially responsible for the right side of the body and certain parts. So sensation and making your right side move is actually on the opposite side, the left side. So she would have some degree of paralysis and sensory loss on her right side. The left side is also where the speech center is. And so that area, although not directly affected, she might have had difficulty in talking because that's the left side of the brain as well.
Okay, please continue.
The 5th injury of her head is the description of her strokes. And as I described, they're on the left side of her brain, and I described the location where they are, and in the front portion as well as the back portion of her left hemisphere, which is the left half of her brain.
All right, and then you move on to the trunk and the extremities.
Yes.
And your findings.
So these are all relatively minor injuries on her body. On the trunk, I described, in the trunk is also the torso. I described multiple abrasions. They're gray and tan, and they're on the skin of the posterior, which is the back, the left lower thorax, which is still where the ribs are, and they're in an area of 3 inches by 1 inch. And these abrasions are sort of on the surfaces of the ribs, and they're just from her brushing against a solid surface or something rubbing against her back. They don't cause any internal damage underneath her. That's the only injury of her torso. On the extremities, she's got 6. And they include a 1/8 inch by 1/16 inch yellow and gray abrasion, which is a scratch on the posterior, which is the back, left upper arm, so near the shoulder, but the tricep area, a 1/8 inch by 1/16 inch abrasion. She has 3 areas of skin slippage. These are the areas that were blisters at one time on her outer portion of her right lower leg and her outer portion of her right foot. And these are in an area of 4 3/4 inches by 2 1/2 inch. So essentially it's between the knee and down to the little toe on the outside of her right leg.
And doctor, based on your training and experience, this skin seepage, how does it cause to be?
Well, based on the color, there's something that came in contact with the skin that irritated the skin. So this could be just because she's lying in a moist environment and it's causing the skin to break down. It could be a burn from either a contact, something touched her, or fluid, although it doesn't really have a fluid pattern, or it could just be if someone was rubbing her to clean her skin. You can just slough off the skin if you rub, because her skin is very thin to begin with.
So
Well, not to
doctor,
begin with, but at the time of her death.
doctor, if this child was lying in a bed full of urine and her leg had been sitting there marinating for days, could that have affected it?
Yes, that could be a reason why she's got those blisters.
All right. Please continue.
Moving over to the left leg, she has another small, she actually has two small abrasions. One is 1/16 inch by 1/16 inch, and that's on the back outside of her left upper leg near the hip.
You do your thing, and you do it well. Now, it's time to do it bigger.
She's got another one abrasion, which are scratches, 1/4 inch by 1/16 inch in the same area of her left upper leg. And then she has a third abrasion that's also 1/8 inch by 1/16 inch, also on the outer portion of her left thigh as well. And then I described that she has at least 6 similar of those blisters that were on her right side. She's got
Yeah,
6,
hold
on
up. You gonna tell me that all of this going on with this little girl, ain't nobody send nobody over there to do no welfare check? The off police over there to check on their sister to see what's going on because you was just concerned. I mean, check on the baby or something. Somebody in the family is supposed to be dead now. Come on now, this too much. This is really too much. All this going on with this baby, it is too much for me.
The outer portion of her left leg in a larger area. These are 7 1/4 inches by 1 1/2 inches.
And doctor, after you conducted, did you have any findings with regards to your internal examination of this child's organs?
Well, as I stated, most of her organs, they're normal. They're a little underweight because of malnutrition, but her lungs were collapsed. Her pancreas is inflamed, and she's got the hemorrhages on the inner lining of her stomach. She does have some fluid that's in her stomach as well as in her intestines. It's not a whole lot, but there was some that was in her stomach and intestines. But there's no congenital or birth defects. There's no other signs of direct trauma to any of her abdominal or chest organs. Just as I described, complications of malnutrition.
And doctor, once you conduct your internal examination, do you also follow that up with microscopic evaluation of the organs? And can you tell the ladies and gentlemen of the jury why you do that and what your findings were with regards to Aniya?
Are you a low-income
this the
American
part I
on
wanna
food
hear.
stamps or Medicaid? If
It's
so, you
fine.
are now eligible to receive a
Yes. Part of a complete autopsy is not only to examine the body with our naked eyes, but we use the aid of a microscope to look at various tissues to help confirm suspicions that I was thinking at with my naked eye. And so I look at all of her organs, looking to see if there's any complications or confirming my suspicions. And so I looked at all of her organs, and the lungs looked like there might be some pneumonia present. It wasn't pneumonia underneath the microscope. It was just the hemorrhage, the bleeding because of the terminal or near-death shock. Her pancreas was red and inflamed with my naked eye. I confirmed that with the microscopic examination. I'm able to get a better idea of how old the subdural hematoma is by looking at the cellular structures and how the body is trying to cure and heal itself. I'm able to get a better idea of the extent of her strokes, how long they've been present. All of that is more of examination of the tissues underneath the microscope.
And what were your findings when you looked under the microscope with regards to the trauma to the your subdural hematoma, trauma to the brain?
Well, as I stated, it's been the subdural hematoma has been present there for a minimum of 10 days. It's more likely 2 weeks
10
or
days.
advanced, but certainly 10 days prior to her death. The strokes are also an ongoing evolution of the strokes, and they've been developing for a similar time frame for about a week or 2 weeks on up. It could
So
be
y'all
even
saying 10 days, 2 weeks, ain't nobody came over there and checked the welfare of that baby. That means that nobody care. I'm gonna stop it right here, y'all. I don't heard enough and getting frustrated, but that baby been like that for 10 days, y'all. Even if my sister and I are not talking nothing like that, if I feel that something going on in that house, I'm gonna get somebody to do a welfare check. Even if you have somebody you know to go over there and knock on the door. You know what I mean? Because 10 days and she been like that 2 weeks and all that kind of stuff like that. This is not even good. Real deal, you know what I want you to do? Get in that chat and tell me what you think. Please participate and tell me as a mother, a auntie, a sister, a cousin, talk to me, please. Okay. I'm out.